Hello, I'm Ed Courtney, Assistant Superintendent for Curriculum Instruction in Missoula School District 1. Welcome to an overview of the District 1 HIV/AIDS curriculum. With me in the order of their presentations are Renee Herbst, School Nurse in District 1, Linda Null, our District 1 Curriculum Coordinator, Martha Swanson, Grade 3 teacher from Mount Jumbo School, Mary Jo Swartley, a 4th grade teacher from Paxson School, Ed Johnson is Grade 5 teacher at the Dickinson School, Lynn Lundgren, a counselor at the Washington School, Karen Flint is a 7th grade teacher at the Rattlesnake School, and Barbara Lacko is a 7th and 8th grade PE health teacher at the Meadow Hill School. Before turning the program over to the presenters, I would like to give you a kind of quick historical overview of how we got to where we are with this curriculum. During 1991-92, a health survey was conducted of students and teachers in District 1. Student input reflected that they desired more information about AIDS. These survey results were presented to the school board in May of 1992. The full health committee was formed during the 1992-93 school year and included teachers, administrators, and parents. The PTA council was contacted and asked to solicit parent representation. Parent representatives at this time included Gwen Gamrant and Bonnie Leifer. Bonnie, incidentally, is from the Missoula County Health Department. Subcommittees were formed according to health topics, and the groups worked throughout the year. Russ Hooper and Denise Potter attended the AIDS/HIV subcommittee meetings in the spring of 1993. In May of 93, a recommendation from the full health committee was presented to the Curriculum and Instruction Committee of the board. The C&I committee asked for more detailed information on the AIDS/HIV curriculum. So during the summer of 93, the AIDS/HIV subcommittee worked to compile the desired information and organize the AIDS curriculum. Work completed during the summers was to coordinate the recommendation of the committee and not to add new learner outcomes. A detailed AIDS curriculum was presented to the C&I committee in September in part and again in October, which included definitions and lists of materials to be purchased to implement the program. The revised AIDS curriculum was an information item at the November 1993 full board meeting, and the curriculum materials were made available for public review. Because of public interest and to give greater opportunity for public review of the curriculum, the recommendation at the December board meeting was to delay the decision regarding the adoption until the February meeting. This will allow not only further review and input regarding the written curriculum, but will also provide opportunity for interested individuals to review the proposed videos at different grade levels. Now, I would like to turn the rest of the program over to the presenters of the curriculum. And the first will be Renee Herbst.
Thank you. The number of people estimated to be infected with HIV in the United States is 1.5 million, with one of the fastest growing groups to be in our teenage population. We often think of HIV and AIDS as a big city problem, but in our highly mobile society, people living with the HIV infection are found in many rural areas as well. In Montana alone, there are 419 known HIV cases, with 56 found in Missoula County. All of these individuals are soon to be capable of spreading the virus. To be able to stop the spread of the AIDS epidemics, we all must understand the disease, its cause, its nature, and its prevention. Education concerning HIV and AIDS therefore must start at the lowest grade possible. Our curriculum includes materials from grades kindergarten through 8th. We have taken materials currently in use from 1988, supplemental materials from the Office of Public Instruction, weekly readers, and Rodale Publishers Straight Talk, and various videos. From these materials, we have redesigned our curriculum to fit the needs and goals of our community. We ask that you provide us with any written recommendations that you may have after viewing this program.
Hi, I'm Linda Knoll, Curriculum Coordinator for Missoula School District 1. Kindergarten, first and second grade health curriculum incorporates goals for teaching about communicable diseases and awareness of healthy behaviors that can prevent illness. Other goals include understanding how healthcare professionals help people who are ill and how students can show love and support for sick people. AIDS is not one of the diseases discussed. Kindergarten, first, and second grade teachers already have extensive files of activities for teaching these concepts. As the committee reviewed and rewrote materials, they found supplementary materials from the Office of Public Instruction. Some of these materials provided excellent activities which could be integrated into the health curriculum. The committee is recommending providing kindergarten, first, and second grade teachers with these materials, and they can choose to select to use them as they are needed with their instruction. The second grade materials include the concept of chain of infection. This concept, chain of infection, becomes a common theme throughout the upper grade levels. Kindergarten, first, and second grade teachers are provided with the same guidelines as previous curriculum on how to deal with questions that students might bring up about AIDS. Teachers are to stress that AIDS is a hard disease to catch. It is not spread easily, like a cold or flu, through coughing or sneezing. And a list of ways that you cannot get AIDS is provided. This list includes hugging, kissing, holding hands, sharing drinking straws, sharing toys, or playing with somebody who has AIDS, or through any of our normal day-to-day activities. Teachers reassure students that they do not need to worry about getting AIDS. If students ask teachers for further information, the teacher is to respond by saying that it's a difficult disease to get and to understand. They are also to talk to their parents if they want more information, and they are again to reassure the students that they need not worry about getting AIDS. Parents might ask, why are we recommending AIDS awareness education in the third grade? 8 and 9-year-olds are becoming more aware of others outside their families. They are becoming concerned about people and events in the world around them. They read and they're exposed to news, and they are hearing more about AIDS. At this teachable moment, we want to give them accurate information to alleviate any fears that they may have. We want to provide them with information and knowledge about the disease, how it affects the body, how it is spread, and how students can prevent becoming infected.
I'm Martha Swanson, third grade teacher on the Health Committee. On the screen you will see the key concepts for our AIDS education in grades 3 through 6. They've stayed the same except for the addition of number 2, which reads, to understand the effects of HIV on the body's immune system. We've increased our resources and extended lessons to help us reach these goals. Our past focus was to reduce children's fears by listing many ways in which they could not catch AIDS, such as sharing food, touching their friends, coughing, and using public fountains. Another change is under the general methods of transmission, which you see on your screen. The change reads, the most common ways people become infected with HIV are sexual contact and blood-to-blood. For example, sharing needles, razor blades, etc. It can also be passed from an infected mother to her unborn child, a fetus. And those are the two only changes in our curriculum. Again, any additional questions were to be referred to parents and guardians. In our proposed curriculum, we have several suggested activities and materials for use. We have information about disease-causing organisms such as virus and bacteria. There's a vocabulary list which defines and explains needed terms such as communicable diseases and immune systems. One activity is to show why it's important to wash hands to help prevent the spread of germs. We're going to sterilize 2 jars, and one child will scrub very thoroughly with soap and then peel a potato and seal it in a jar, being very careful not to touch anything else. Another child will peel a potato without washing hands and seal that in a jar. After labeling the jars and putting them in a warm place, we will observe such a mass of mold and bacteria colonies on the unwashed specimen that children should want to wash their hands and avoid putting other things in their mouth, such as pencils and so on. We have a very age-appropriate video called Beginnings, You Won't Get AIDS. It shows youngsters playing soccer when one little boy gets scraped and starts to bleed, and he is worried about getting AIDS from his blood. The coach cleans them up and they finish the game, and then they gather around, and through animation and songs and real children, they discuss the ways that AIDS can be transmitted and what you can do to help keep your body healthy and safe from germs. It discusses good health habits and how to treat someone who has AIDS by being kind to them. This is one of our concepts of accepting others with differences. Another teaching resource is a booklet from Weekly Reader called Learning About AIDS and Other Diseases. This is a teacher guide that includes stories and discussion questions about diseases and how they're spread, about your immune system, and what AIDS means and how it's different from other diseases. It's compared to polio, and it helps us to understand how communicable diseases affect family, neighborhoods, communities. There are also stories of helping someone who is sick. I estimate the entire curriculum could be taught in 5 lessons of 30 to 40 minutes.
Hi, I'm Mary Jo Swartley, and I'm here to talk about the 4th grade curriculum that we've developed for teaching about AIDS. The main objective that we've had in changing this curriculum from 1988 is to provide students with more accurate, updated information. Lack of education often creates irrational fear about this disease, and it also has harmed the way AIDS patients are treated and has interfered with progress in the prevention of the disease. By educating our students about AIDS, we can help to eliminate some of these unfounded fears and myths surrounding the spread of the AIDS virus and help the students to develop the understandings they need and the responsible behaviors which can help to prevent the spread of AIDS. As with the 3rd grade, on the screen we've listed the summary of AIDS education, the key concepts. We have 2 added, number 2, to understand the effects of HIV on the body's immune system. We've then provided teachers with materials and activities, especially the Weekly Reader, to help teach these concepts. We want students to understand the difference between HIV and other viruses, that it's not spread easily like colds and flu, that it reacts differently on the body's immune system, that it lasts until the person dies, and that there are no cures or vaccines for this disease, but scientists and doctors have learned a lot about it, and they're working hard to help AIDS patients. 4th grade has also made some changes in general definitions. We wanted students to understand that it's the virus, HIV, that people become infected with, that they can become infected only by another person already infected with HIV, and that full-blown AIDS symptoms develop later. I'd like to stress that what we really want kids to know is the risky behaviors that spread the disease, that students can choose not to engage in those behaviors, and then they don't need to worry about becoming infected with AIDS, even if they're around someone who is infected. So in 4th grade, we too have changed the wording under the methods of transmission, like in the 3rd grade. We wanted to give students more specific, accurate information about how AIDS is transmitted. We felt that under the old methods of transmission, simply saying the vague notion that it can be spread through kinds of physical contact left kids with lots of fear. So these 3 methods are the specific ways that AIDS can be transmitted. In 3rd and 4th grade, we do not teach about human sexuality. We did want students to understand that there is only specific kinds of physical contact that transmit AIDS. And so as a committee, we're examining ways to deal with the term sexual contact, and we would invite your written suggestions about this. If you look at the curriculum that we have developed for teachers to use, I envision this for 4th grade being about 5 or 6 30-minute lessons, depending on the interest and the discussion that takes place in a particular classroom. The goals are very similar with other grade levels. In the 4th grade, we begin by pre-testing students on their previous knowledge about AIDS. And then we provide some models and activities, and especially readings from the weekly reader, to discuss communicable diseases and how they're spread, to discuss how differently the HIV virus is spread and its effects on the body. In the weekly reader, there are 2 excellent demonstrations. The first uses a spray bottle as a model for how a common virus, such as cold or flu, is spread. And the second demonstration uses a medicine dropper to represent an IV needle and colored oil to represent the blood, to show how HIV is spread through the blood. HIV is spread through the blood, and the discussion in the weekly reader talks about the kinds of behaviors that students can say no to, and then they won't need to worry about becoming infected. It talks about not injecting drugs with IV needles, or sharing needles to pierce ears or to tattoo, or to use a razor and share a razor to become a blood brother or sister. And again, it discusses that if students do not engage in those kinds of risky behaviors, they don't need to worry. In this blood-to-blood discussion, the weekly reader brings up the fact that in our early understandings from 1981 about how AIDS is spread, people didn't know that it could be spread through the blood, and blood for transfusions was not tested. Now all blood is tested for transfusion, and we no longer need to worry about becoming infected in that way. Okay. In the yellow packet of curriculum materials on the Goal 1 sheet, the posters from CDC are mentioned. We have tried to access enough of those from CDC so that all the teachers in 4th grade can have their own posters. We may have to use those on a checkout basis if we can't get enough copies. Goal 2 focuses on ways to identify, to prevent, and treat and control HIV. One of the activities has students separating myths and facts about AIDS and how it's spread. Small cooperative groups work together to examine 14 statements and decide whether they're true or false. Then the groups report back to the whole group their findings. Those could be tallied, and then with information from the teacher and from the weekly reader, the whole group comes to consensus on which of those statements really are myths and which are facts, and a chart can be made of those. Under Goal 3, the weekly reader gives accounts of people who are infected with HIV. It talks about how their lives have been affected, their families' lives, and their communities. Excellent discussion questions are provided. There are also written activities and role-playing situations. One of those role-playing situations asks students to pretend that they have someone in their family infected with HIV. The situation then asks them to role play telling a friend that why it would be okay for their friend to come over to their house. I think by participating in an activity such as that, it clearly shows that students understand how HIV is spread, their fears have been alleviated, and also that they have gained some empathy for AIDS patients. Also on this last goal sheet in the yellow packet, there is a video recommended for 4th grade. It's a Nickelodeon interview with Linda Ellerby. We have not yet received that video and have not been able to preview it. Therefore, at this time, the committee does not recommend it. That will be eliminated from the final curriculum. Maybe at a later date, we'll be able to recommend that video or another one.
I'm Ed Johnson, the 5th grade representative on the Health Committee, and I'm going to tell you a little bit about our 5th grade program. It consists of, as the other programs, 5 key concepts. The second one that we have added this year is to understand the effects of HIV on the body's immune system. In order to help develop an awareness of these concepts, we'll focus on 4 student outcomes. That of identifying AIDS as a disease that is difficult to get, identifying AIDS as a disease caused by a virus, explaining the AIDS virus attacks the immune system, and to discuss the importance of responsible decisions that promote good health. We have made some changes in the general methods of transmission. The previous reference to AIDS virus is now talked about as HIV. Also, we have added the terms blood to blood, razor blades, and etc. And we have ended up the transmission method with it can be also passed from an infected mother to her unborn child or fetus. There are a number of changes in the language that we have included in the 5th grade program. AIDS virus, in many cases, has now become HIV. Under the symptoms, clarification has been made by adding the time between becoming infected with HIV and the appearance of full-blown AIDS. And we have also changed the top-end time to include from 3 months to 10 years or beyond. The statement also made with this is that people who are infected with the virus can infect others even though people who transmit the infection do not feel or look sick, and we have also added in any or realize that they are infected. We have a number of materials available to help us present this program in the 5th grade. One of these will be a pretest to determine prior knowledge before we begin formal instruction on the AIDS program. A second will be a discussion of the AIDS acronym using a visual transparency. We will also have a teacher information sheet and some overhead transparencies to which we can refer that will help us in the presentation about the body's immune system. One of those transparencies will refer to the immune system, and it shows the progression of a virus causing a cold and also the progression of a virus that would cause the HIV infection. There also is available a video. This video is the I Have AIDS, a teenager story. It's the story of Ryan White. And we will have in the final suggested activity a student worksheet accompanied by teacher information that helps students become familiar with risk, no-risk behaviors. And we will be presenting that to include things like skateboarding, the use of alcohol, using someone else's comb, sitting by someone with AIDS. Students will take each one of these and decide whether they are risk, no-risk behaviors and give their reasoning along with this. The approximate time for this whole program in the 5th grade should not take any more than about 6 days with 30 to 40 minutes a day.
Hi, I'm Lynn Lundgren. I'm a counselor at Washington Middle School, and I'm going to talk to you today about the 6th grade HIV/AIDS curriculum. It dovetails well into existing curriculum. The science curriculum at grade 6 teaches human reproduction and communicable diseases. The sex education curriculum that's in place changes with puberty and the changes that children are going through at that age. We also have personal safety and decision making in place. And we have some newly written lessons that will be available for your perusal this spring on how to increase self-esteem and increase the quality of emotional and social development and to help our children make healthy lifestyle choices. The HIV/AIDS curriculum at grade 6 can be covered in 5 lessons. The first lesson deals with the historical development of the disease and some of the definitions of what the disease is. There's a video called Answers for Young People that District 1 is still waiting to get and will be available for your viewing when it's in place. The second lesson has to do with increasing their vocabulary and understanding of the chain of infection. It involves a matching exercise and a quiz, and it introduces a new word to the vocabulary for grade 6, which is condom. The third lesson presents a video called An Interview with Magic Johnson. It takes place with Magic and presenter and some K through 6 school children, 2 of which are HIV positive, and one that has a brother who's had a family that's had to move several times because of the brother's illness. He discusses what it is and how you can get the disease. Also, they have a rap that's kind of musical that 6th graders will enjoy, all of the ways you can't get the disease. It stresses that you can still be friends with carriers and that kids that are HIV positive need a lot of understanding and acceptance. It does mention that anyone can get the HIV virus from unprotected sex. It shows a condom so that kids will know what it is. And it makes a point of stressing that children should consider no sex until marriage, and also that it's very important that they talk to their parents about sex so that they have a lot of information and knowledge, and the parents are part of that decision-making process. It also interviews the 2 children that are infected. Basically, there's a sense that they just want to be treated like everyone else, and there's some anger at the fact that they got this disease through birth. The last 2 lessons would have to do with first high-risk behavior. There's a tendency amongst middle school children to make poor choices, and this dovetails back into the personal safety and decision-making as far as kids doing role plays, learning assertiveness skills, dealing with peer pressure, and all of the things that they have to deal with in order to say no to unsafe activity. The last lesson deals with the community concern of disease in general and how communities such as Missoula, for example, through the health department, can educate children to make healthy lifestyle choices, and the community can provide ways to get the information out and give kids opportunities to live in healthy ways.
My name is Karen Flint. I teach 7th grade at Rattlesnake Middle School, and I'm here to talk to you about the curriculum changes for 7th grade. In the 7th grade, HIV/AIDS is taught as a portion of the sexually transmitted diseases section of the human sexuality curriculum. Currently, the curriculum requires approximately 4 50-minute class periods, beginning with the first class discussion, which is an introduction to STDs, or sexually transmitted diseases. Topics of this class discussion includes STDs as a definition, abstinence, prevention, and living healthy lifestyles. Abstinence is also taught in the peer pressure and refusal skills section of the health curriculum earlier in the year. We also use 4 activities from Lifetime Learning Systems dated 1989. Just the Facts, the first worksheet, is a fill-in-the-blank question sheet based on reading information presented on that particular sheet. The second one, What Do You Know?, is a student-parent questionnaire designed to promote discussion between the parent and child at the home. The third is Your Best Behavior, which is about peer pressure. And the fourth, How Can You Help?, is an activity used to promote awareness in the family and the community. We also have a video, AIDS Protect Yourself. What AIDS is, ways of transmission and prevention, the importance of educating yourself, and abstinence are all covered in this 16-minute video. The only other material approved for use is an informational lecture on STDs and AIDS, which was adopted in 1988. The new curriculum, which was compiled over the past 2 years and written this past summer, includes the following new materials and is based on the 3 goals designed to meet the learner outcomes. These new materials include updated background information for teacher use, a teacher resource book, Education for Sexuality and HIV/AIDS, which will be located in each middle school library, a sample lecture on HIV/AIDS, a video entitled A Million Teenagers, which discusses STDs, and a weekly reader, AIDS What Teens Need to Know. And this book provides facts to help students develop the desired understanding and responsible behavior that can prevent the spread of AIDS. It explains why it is important to learn about AIDS, what causes AIDS, who can get AIDS, how to avoid contracting AIDS, and what is being done to help people with AIDS. Thank you.
Hi, I'm Barb Lacko. The 8th grade curriculum is similar to the 7th grade in that the HIV education is included in the STD unit of the human sexuality curriculum. The human sexuality curriculum is also being updated this spring. It is probable that this 8th grade curriculum will be expanded to 16 class periods, each being 50 minutes long. It's difficult to separate the HIV/AIDS education curriculum from the sexuality curriculum, but what we have done is set aside 4 50-minute class times specifically for HIV/AIDS education. HIV/AIDS may also be mentioned in other classes, but the major source of information is the 4 specific AIDS lessons. This happens throughout our curriculum. For instance, abstinence is specifically taught during 2 50-minute class periods, but then discussed 7 other different classes. Previously approved materials include the Health Skills for Life, the Straight Talk magazine, and the basic HIV/AIDS education presentation. Also, there are 2 videos. The Subject is AIDS and Stop AIDS. These have all been previously approved and have been used in the teaching of human sexuality. The Current Health Human Sexuality Supplement, ABCs of STDs, is a more current version of the previously approved article and will probably be used in the STD portion of the curriculum. The 8th grade HIV lesson that is included in the yellow packet of information is being added this year and is a lesson from the Office of Public Instruction. The 1 video, Teen AIDS in Focus, is also up for approval to be added to the AIDS curriculum.
Hi, I'm Renee Herbst. A glossary of terminology has been updated and provided for teachers' use.
Hi, I'm Linda Knoll. The curriculum and materials which were discussed today are available for your review in the Curriculum Office of Missoula School District 1. The administration building is located at 215 South 6th Street West. The videos will also be previewed during the last 2 weeks of this month.